patient has MI, and normally what we
Yeah.
do, we give nitrates. In general
Yeah.
terms, we give nitrates.
Yeah.
Or we can give that clopidogrel, aspirin, atorvastatin can give. So my
Yeah.
question was, what I know is inferior wall MI, we cannot give nitrates. Look, when to
Yeah.
get the call of giving nitrates then? If you don't know, if the
And
person
to
doesn't take a call at when to give
okay, when
nitrates.
to take a call.
No.
Okay, so that is a very good question because ideally, as he told, any patient with MI, we give aspirin, clopidogrel, atorvastatin, and we also give nitrates, right? But if you are in outpatient hospital, you're not able to find out whether it is an inferior wall MI or anterior lateral wall MI. In such patients, whether to give nitrate or not isn't important, but you can always see his peripheral pulses, right? And also you can go by symptoms. If the patient is having vomiting, or that means the patient is having inferior wall MI, or you can check for his dorsalis pedis, which will tell you about his approximate systolic blood pressure, right? So that means if his blood pressure is at least good, and what are you worried about in giving nitrates is that he might die because of hypertension. That is a very important thing in inferior wall MI, right? So these are the things that will help you to decide. Well, if you're in outside the hospital setting, if you're inside the hospital, obviously we'll limit giving nitrates in an inferior wall MI. But if you're in outside the hospital setting, a patient with chest discomfort, check for his peripheral pulses. Look for his dorsalis pedis. If the patient is having altered mental status, that means he's having hypertension, right? In such case, also better not to give. But it is also very important drug because if it is simple coronary vasospasm, it'll relieve the spasm, it'll vasodilator. So it is a very good drug, but it should be cautiously used.